Welcome, everybody. Thank you for joining us today. The topic today is Aging is Mandatory, Arthritic Pain is Optional. Our presenter today is Dr. Gary Oswald, a diplomat of the American College of Veterinary Internal Medicine and is a board-certified specialist in the field of veterinary internal medicine. Dr. Oswald received his BS and DVM degrees from the Ohio State University. He interned at Oradell Animal Hospital in New Jersey, and then completed a medical residency / master's degree in internal medicine at Colorado State University. He has been in private specialty practice since 1991 and is currently the department head of internal medicine and department co-head of emergency services at Tampa Bay Veterinary Specialists and Emergency Care Center. He is the author of multiple veterinary articles and presents continuing education series lectures throughout the United States, Caribbean, and Central America. We welcome Dr. Oswald.
Hey, Carolyn, thank you for that introduction. I'll have to get you a new one for tomorrow evening as we're doing this presentation again, as I'm no longer at Tampa Bay Veterinary Specialist. I sold that practice and my contract ran out at March 31st, and I'm a free agent now. So I'll tell you a little bit more about that. Yeah, I'll tell you a little bit more about that in a second. So here you see this nice dog that's got kind of a hair coat like I do, that big puffy white hair. But I also feel for this dog nowadays because as I get older in my career, I definitely have gotten several college athletic injuries that have become arthritic. And I understand the aging is mandatory part, but I'm certainly working on the arthritic pain is optional. You know, as an internist, it's kind of funny because for years, as a veterinary internist, we sort of try to run away from osteoarthritis. We always want to push that disease onto our surgeons. And our surgeons, I think, do the same thing. They want to run away from it oftentimes because it's not something they can cut, cure, and be done with. So again, as an internist and seeing a varied population of patients, a lot of geriatric patients with concurrent diseases over the years, it's almost become mandatory that I become versed on osteoarthritis because so many of my patients have it and are also on medications that we have to definitely put some thought and consideration into because of other issues. So let's go ahead and we'll start. This will be a talk on managing osteoarthritis in dogs and cats. It's not going to be any earth-shattering new news to anybody, but it's sort of a take-home message as to how I really try to look at osteoarthritis in dogs and cats and myself to some degree, and try to give you what is, considered the current information on the availability for certain treatments. I have two financial disclosures today. This seminar is sponsored by CC Animal Health out of Santa Fe, and I am a consultant for them, and we'll talk about one of their products. I'm also a consultant for PRN Pharmacal out of Pensacola. We'll be mentioning one of their products for arthritic use as well today. Okay, well, you can't start any presentation without a video nowadays, and this is a nice little video I just took off of Facebook this morning. You see these cats, they definitely can't afford to be arthritic because they're going to have to stand in that position for quite a while to empty that tank before they can ever get to those fish. So always have to have a cat video to start. So osteoarthritis from a pathophysiology standpoint, we'll simplify this quite a bit. There's various causes as to why patients in our fields get arthritis. Some of it is certainly genetic predisposition, as we know, in a lot of the larger breed dogs. We certainly see post-trauma, in my case, post-surgical osteoarthritis developing in patients. So again, there's a number of reasons why we develop issues with our joints. Just again, make it very simple. Arthritis is simply a loss of the proteoglycans and collagen that make up cartilage. And with loss of cartilage, you expose the subchondral bone. That bone becomes sclerotic. There are nerve endings in that bone. Eventually, that bone can become bone-on-bone contact within the joint from the loss of that cartilaginous cushion, and certainly can create significant pain and inflammation. There's periarticular new bone proliferation, which you certainly see in both of these radiographs of fairly advanced arthritis here. And over time, the synovial membranes become inflamed. Bottom line, it's a progressive, painful disorder. It inhibits mobility and inhibits quality of life. When you look at prevalence estimates, and I would agree with this in my practice, probably upwards of 90% of patients that are considered geriatric will have some degree of arthritis, whether it be mild, moderate, or severe. So certainly something that for us in private practice, we really see on a day-to-day basis. I'm not going to go through all the clinical signs of osteoarthritis because obviously they vary considerably. But the point of this slide is several things. One is most of us and most owners oftentimes think of osteoarthritis as an obvious lameness, either a patient that's favoring one leg versus the other, even to the point of significant disability. But it entails a lot more than that when you really look at clinical signs. There's definitely reduced mobility as far as stiffness, maybe reluctance or hesitance to get up and down. Patients oftentimes that have been jumpers on furniture or stairs have difficulties getting up and down from those positions. Cats specifically oftentimes have more trouble in the litter box. I have an older 17-year-old cat now that no longer crouches well, and we had to get a modified litter box for him so he wouldn't shoot urine off the lid of the box. In addition to that, we see reduced activity. Oftentimes these patients have non-specific changes where they sleep more, they just don't do as much activity, and many owners just blame it on old age, when in fact it can be discomfort and pain from their arthritic conditions. Many times that means they don't interact as much with fellow animals in the house or their owners. Altered grooming, again, if you have cats, that's one that we oftentimes will see that either they can't reach certain areas of the body comfortably to groom, or they spend more time grooming specific areas over joints that may be painful to them. Overgrown claws would be another thing to consider, as these patients oftentimes don't bear weight normally on their limbs, dogs and cats. And then lastly, you see poor Grumpy Cat here, who I think passed away in 2019, and the cohort Grumpy Dog. Temperament changes are very commonly seen where these patients are grumpy and irritable when they're handled. Again, many times they avoid that interaction, spend more time alone. So definitely lots of things that owners probably recognize more than we're going to recognize in the exam room. As such, I think one thing that really makes sense in private practice is to have owners in their time before they're seen fill out a pain survey. Try to get an idea of whether their dog or cat is exhibiting any of these other signs that are not obvious lameness, so that it helps us as doctors identify that this patient may be suffering from arthritic pain. Colorado State is not the only people, but I have their stuff up on the board here that have online pain scores and mobility scores for both dogs and cats. You can get them from other sources online as well and employ those as client surveys, which again should hopefully help identify patients that have some of the earlier signs of arthritis. Now, as far as treatment of arthritis, where we want to spend the most of the focus of today, it really has become a multimodal approach. When I first got interested in arthritis and pain relief many years ago, it wasn't so much a multimodal approach. I think most of us got hammered by drug companies that were coming out with these new NSAIDs, these COX inhibitors, and each specific drug company certainly had their own drug that they touted as being better for specific reasons compared to their competitors. And we got all kinds of frisbees and coolers and coats and sweaters and free things from these companies to bring this into our attention. And I think the focus primarily back then was drugs, drugs, drugs. And again, you have to be careful in people because many times it's the same thing. If you look at TV, you'll see all your ads for arthritic pain relief medications. And medications, drugs certainly do reduce inflammation and pain, but there's lots of other things that go in, I think, to successfully and better management of osteoarthritis. Starting from the top, optimizing body weight and condition, and modifying activity to still continue to be active, but maybe in a more moderate way. I can just tell you, since I left my previous position, part of the reason I decided to take a leave of clinical practice currently is to work on myself a little bit. I've gotten to a point where I was convinced I probably needed 3 different joint replacements, and losing some weight in the last couple months, increasing my activity and modifying activity to go out on walks and ride bikes and so forth has made my joint health tremendously better by itself. So you can't overemphasize those things. We'll talk a little bit about chondroprotectants, a number of nutraceuticals today. We'll talk about some ancillary treatments and devices that may help arthritis. And again, lastly, we'll talk a little bit about modifying our patient's environment. So it is a multimodal approach. It's not just all about drugs. And that, for me as an internist, really becomes important because, as we said, a lot of our patients are geriatrics. And as such, we've gotten into screening of our older patients nowadays. We have all these new ways to look at kidney function. Certainly, we know that drugs used for arthritis affect kidneys, they affect the liver, they affect the gastrointestinal tract, the coagulation system. So we have to be aware of, again, using and what the effects of these drugs certainly might be. We don't want to do any harm to our patients when there may be other modalities we can use that spare some of the organ concerns we might have. And then when you look at cats in particularly, cats are certainly not little dogs. Cats that get arthritis and any disease process are unique many times in our difficulty inherently in giving them medications. The effect of polypharmacy, trying to give a cat 4 or 5 pills, it might be easy to put those in a meatball for a dog, where that could take you all day to accomplish that in a cat. Cats sometimes handle drugs, of course, differently than dogs. And many, high number of geriatric cats over 10 years of age, we certainly know have concerns with kidney issues. So we want to look again in cats very carefully as far as what we can accomplish, how we can help them with arthritis. So let's start from the top and look at weight loss first, very briefly. I'm not going to go into a long diatribe about weight loss, but again, I can tell you from my own experience personally, but also professionally with dogs and cats with arthritis, that losing weight and getting down to a leaner body condition, taking some of that stress off of these major peripheral joints plays a big role in improving mobility and lessening signs of arthritis. And again, many of our clients really don't recognize their pets are overweight, or they think it's cute. They feed them so many treats. And again, there's something that we need to, get people to focus away from that and try to get into healthier lifestyles, especially for these pets as they get older. Losing weight, of course, there's plenty of ways to do it by restricting calories. We have plenty of weight loss formulas. We can still use tasty foods and restrict the amount of calories patients take. And again, we should really stress that treats should not make a major part of our diet. They should be definitely no more than 5 to 10% of the daily caloric intake should be from treats. We want to get out, especially in dogs, and increase walking. Good for the person, good for the animal. If you live in the southeast United States like I do, everyone has a swimming pool. Getting those dogs and sometimes special cats fitted with their life jackets and in those pools, taking some of that stress off, but still burning calories and enjoying time with the family. And of course, with cats, we can do things like laser tag and so forth, and mouse on a string to get them going a little bit better. But I can't overemphasize, and I can just tell you in the last 4 months, weight loss for me has been a tremendous impact on my mobility and my ability to decrease pain, especially in my knees. As far as modifying activity, again, we want to get out. We want to do more. Sitting around with arthritic joints simply makes them worse. You've got to maintain some form of a moderate activity program that's going to maintain and strengthen muscle mass. And that muscle mass is so important for supporting those periarticular tissues around these joints. And again, by itself, that helps relieve pain and improve mobility, improve range of motion. Even getting involved in physical therapy for dogs, whether it be, again, in your own pool at home if you have one, or getting involved with a local physical therapy center, can play great dividends in improving range of motion and decreasing pain. And I'll tell you, massage is good. I got into doing massaging for my own joints as well. Look at this cat here. If they were all that simple, my orange cat would probably bite me if I tried to do that with him. But you can see this guy really enjoys having that body massage. But anything we can do to flex, extend, keep these joints mobile makes a huge, huge difference. Now let's get into things that we can administer to patients beyond exercise and weight loss. Chondroprotectants get a lot of attention as far as nutraceuticals that might improve joint health. So let's take a little bit of a look at that because we have a lot of those in veterinary medicine. Certainly with nutraceuticals, there are some things like glucosamine chondroitin and collagens that are touted to slow cartilage degeneration, maybe improve the elastic property of joints. These products contain some of the building blocks of cartilage, so they hopefully contribute to cartilage repair over time. And again, that may lead to less synovial and joint inflammation and less pain, thus slowing the progression of osteoarthritis. Again, do these things work and what is available to us? One of the big things we have to be concerned about, though, and recognize when we use these upcoming products is compared to NSAIDs, where you can take an NSAID and get an almost immediate improvement within 15, 20 minutes of pain reduction. We know that from taking drugs that we take for arthritis. When you look at chondroprotectant agents, there's a delay of weeks to oftentimes months in what these products would do. So these would definitely be products best used early in this disease process where we still have a substantial amount of cartilage that maybe can react beneficially to these. So these would be things like your glycosaminoglycans, which would be your glucosamine chondroitin hyaluronic acid type things. Certainly we have a whole host of these in veterinary medicine. Cosequin would be one of the certainly recognizable brands to everybody. Coming both in oral products. We also have injectable glycosamine products like Adequin, which certainly these things have been shown to benefit some patients both in clinical studies and also from observational surveys from clients. Green-lipped muscle extracts are another popular one, has been shown scientifically to not only be rich in glucosamine chondroitin, but contain antioxidants and certain vitamins that may again be beneficial in reducing joint inflammation and helping in reparative processes. Bottom line with these sort of things, guys, again, is three things for me. They might help, as you see, and they won't hurt. They need to be instituted early in the disease process when you still have an adequate amount of cartilage within the joints. Once you get to bone-on-bone contact and advanced arthritis, much less likely that these sort of products will be helpful to you. And then lastly, expect a delay. You're not going to see an immediate response. So in a patient with clinical signs, they may need to be started on something else like an NSAID for the first few weeks while you allow chondroprotectants to hopefully show some benefit, and in which case you may then be able to taper the dose or completely discontinue drugs like NSAIDs over time. The hard part with these is, again, it's like anything else in medicine. We don't have a tremendous amount of evidence-based studies that say a large majority of these patients will respond. It is hit or miss. But again, if a patient is acting more comfortably on these, we certainly don't want to dissuade owners from using chondroprotectant medications or nutraceuticals. There's a couple other ones I think that are really potentially helpful. That are more anti-inflammatory. They don't contain glucosamine chondroitin per se, so they're not as much about repairing cartilage damage. These would be things like your undenatured type 2 collagen extracts, your omega-3 fatty acid supplements, and another supplement called Microlacton. So let's briefly look at these nutraceuticals. All of these have clinical studies that have shown benefit in patients, and also again have surveys where clients have told us there can be benefit. Undenatured type 2 collagen is made from chicken cartilage, specifically from the sternum of chickens. The proposed mechanism is very different than glucosamine chondroitin. This collagen is supposed to induce something called oral tolerance, which is an induction of the immune system of the GI tract. And then that stimulation, if you will, of this immune system should translate specifically to joints, where it basically would alter or to some degree suppress some of the local immune response directed against exposed collagen within joints. So it is a way to, in fact, try to alter your immune system and lessen inflammation in the joints. There's a couple of studies been performed in veterinary medicine in the last decade that show that maybe there's a better response to this type of undenatured collagen compared to glucosamine chondroitin. So certainly something to consider. And there's a number of different brands of UC2 supplements that can be given. You see one on the slide here that again may offer some condor protection and some reduction in joint inflammation, usually given once a day, where glucosamine chondroitin oftentimes needs to be given several times. And these products can be combined oftentimes with omega-3 fatty acids in their formulations, which is nice because you sort of get more bang for your buck in that degree. So again, definitely something to consider. I think for most of us, omega-3 fatty acids, we've seen plenty of things in the literature showing us how EPA and DHA alter arachidonic acids, suppressing certain cytokines that are involved in whole body inflammation, not just the joints. But again, omega-3 fatty acids should have an ability to reduce joint inflammation related to osteoarthritis. And one of the nice things in older patients, there is some improvement in glomerular hemodynamics. So if you have a patient with concurrent or older kidneys and maybe some evidence of early kidney dysfunction, omega-3 fatty acids may play more of a whole body benefit, including the kidneys. Again, just to tell you a little story, I have high triglycerides, and my cardiologist recently changed me from over-the-counter omega-3 fatty acids to a new pharmacologic production of EPA primarily. And since I've been switched to that product during the same time period, it has definitely made a significant difference in my joint mobility and less swelling and less inflammation. So again, I think there is some real rational reasons to have our patients on omega-3 fatty acids when they have osteoarthritis. You can either use an over-the-counter form. The goals are the EPA about 40 milligrams per kilogram per day. Most of the veterinary products and the human products, if you follow that EPA, will bring in about 25 milligrams per kilogram of DHA. And those are the recommended dosages. You also can find that many of the geriatric diets and senior diets for pets are already supplemented with omega-3 fatty acids in that range, and certainly might play a nice role. Especially for bigger dogs, it's sometimes hard to achieve the oral supplementation every day of that amount. It takes multiple capsules. So in bigger dogs, I really prefer to see if we can get them on a diet that is already supplemented with that degree of omega-3 fatty acids. Much easier for the owners to put it in the food bowl than it is to have to individually pill or capsule their dog each day. Microlacton is another supplement that would fall under the anti-inflammatory nutraceutical umbrella. Microlacton is something that I believe was first discovered in Switzerland, and many people there, the Swiss population, swore by microlacton for an ability to relieve and reduce joint inflammation and pain. It's a concentrated milk protein that they derive from hyper-immunized cows. I'll show you what those look like in a second. Basically, it's a non-specific inhibitor. It has a different mode of action compared to steroids or NSAIDs as to how it relieves inflammation within the joints. Basically, it inhibits specific cytokine production, which reduces neutrophil migration and signaling. And without that migration and signaling to specific areas in the body, it acts again as an anti-inflammatory agent. And again, would be very safe. Does not going to have side effects that involve kidneys, liver, GI tract, and so forth. We do have a product in veterinary medicine called Durrell Actin. Is a microlacton product that is available for dogs and cats. It's weight banded, so appropriate dosages are given to these guys in the 30 to 50 milligram per kilogram twice a day range. You can also get it an additive of omega-3 fatty acid combination in addition to microlacton within the same chew for both dogs and cats. Some of the limited research has been done in animals shows that you may see a clinical effect within a week's time period, maximal effect hopefully within about 2 weeks. And again, something that's safe, easy, and certainly can be considered as individual patients may respond better to one type of supplement like UC2, or another may respond better to Durrell Actin. So again, there's some ability to experiment with patients to see what fits their therapy best. Now, hyperimmunized cows, just to make sure everybody's still awake, I didn't know what they were, so I went to Google and I typed in hyperimmunized cow, and this is what I got. You can see this guy in the middle, certainly hyperimmunized. There's one that must be hyperimmunized the way he's galloping around. And there's another one coming through the screen, so I'm assuming those are what are hyperimmunized cows. Just a little levity, hopefully, to make sure you guys are awake. Okay, let's go into drug therapy. So as far as drug therapy goes, I certainly always, as an internist, think it is important to steer our clients away from the over-the-counter products like aspirin, acetaminophen, and so forth that we might use as people. We all are aware of the fact that there can be some specific issues with those drugs in animals. And I think we are far better off to try to get owners to use, our legend or generic COX inhibiting drugs that we've all grown up with over this past couple of decades. And there's a big variety of them on the market, and each company, whether it's carprofen, whether it's daracoxib, whether it's a meloxicam product, whether it's a firocoxib product, the newer one, grapaprant, all of the companies that brought these to market as legend drugs will tell you why theirs is better than one versus the other. I'm not aware of any studies that have looked at head-to-head comparisons between these COX inhibitors or the EP4 prostaglandin antagonist galaprant. But bottom line is, I look at them as one may work better than another. You pick one you're familiar with, you're comfortable with, you try that in a patient. If it doesn't work well, you try another one. But that's the bottom line with those sort of products. Now, looking at reducing joint inflammation and pain, remember with non-steroidal or steroidal drugs, let's look at glucocorticoids down here first, like prednisone, really not recommended for joint pain. If you had severe, three-legged lameness where one day you had severe pain in a chronically inflamed joint, my orthopedic surgeon has always told me it's fine to take a day or two of a steroid to just relieve inflammation quicker, but we certainly don't want to ever recommend glucocorticoids for long-term use. In fact, long-term use would potentiate ongoing joint damage. When it comes to the non-steroidal anti-inflammatories that we showed on the previous page, again, they're nice because they'll provide a more immediate measurable response for a patient who's painful. Again, very commonly used in dogs, at least in the United States right now. They're off-label in cats. We'll talk about use in cats in just a second. But bottom line is, again, as we know, these reduce some of the prostaglandins that induce an inflammatory response, so they're anti-inflammatory drugs. But also remember that some of these drugs can reduce protective prostaglandins that protect kidney function, that protect GI mucosal integrity. And that's what leads us to some of the potential side effects in those organs with long-term use. Cats have reduced liver metabolism. You have to be a little careful, again, potentially with cats, although I'm not really aware of any NSAID toxicities specifically relating to the liver in cats. We also know, though, of course, that dogs, especially Labradors, have had some issues with some of these NSAIDs as far as inducing chronic active inflammation within their livers. So again, these are certainly not the end-all be-all of arthritic management. These are drugs that should be used carefully because of their potential for side effects, but they do play a valuable role in a multimodal approach. However, if we use those other modes, we can hopefully use NSAIDs either on an as-needed basis, or we may be able to reduce dosages, which again would hopefully relate to a protective effect for our patients when we're using them long-term. We definitely want to use labeled dosages in dogs. Again, these are not drugs where we can escalate dosages and get a better effect. Again, if you don't get the effect at the labeled dose, you should try a different NSAID or a different modality of pain control. When we do use them in cats, again, I'll show you in a second, we're going to use them in the United States at a reduced labeled dose from what we would use for dogs. So let's take a look at that. And when it comes specifically to cats, there's been three, I think, really good studies now that have been done in Australia and Europe that show us that NSAIDs, even in geriatric cats, at least from a short-term perspective, meaning 30 days, 60 days that have been studied, when we use these drugs at a reduced dose, you see the dosage is recommended about half for meloxicam of what you would use for a dog. And again, there is a published robenacoxib or Onsior dose as well. These products are labeled for geriatric chronic use for cats in other countries. If we are going to use them here in the US, a couple of things we need to know. Don't use the canine dosing syringe that comes with meloxicam products, because that's designed to deliver a specific dose in pounds for dogs. We always want to make sure in any patient, but it's more so in cats, that we have to have patients that are feeling good, eating good, drinking good. We cannot allow our cats to be dehydrated, as dehydration plus NSAIDs can be very, very detrimental to creating acute kidney injury and seeing these cats suddenly come in much, much sicker. So discontinue use immediately if a cat is not eating and drinking well. And again, like any good NSAID or any good medicine principle, if once you've observed a good clinical response with these type of drugs, if you can, try to reduce the dose, adjust to the lowest effective dose for that individual patient that would hopefully control the degree of pain and inflammation and improve their quality of life. It's a balance. We do want to make sure that we protect, again, other organs like the GI tract and the kidneys particularly. What's interesting about a study done with meloxicam in cats in Australia was that after 30 days, cats' kidney function was actually shown to be slightly improved when they were on this low dose of meloxicam. These were cats that had evidence of chronic kidney disease. The big question becomes, is there actually a beneficial effect to NSAIDs in chronic kidney disease? I think the answer is probably no. But the fact that we improve quality of life in these patients, they're more mobile, they get up, they feel better, they eat better, they hopefully eat their kidney food better, they get to the water bowl more often. Those are more likely potential explanations as to why we're actually protecting these other organs like the kidney by making the patient feel better. So interesting new stuff in cats. Again, certainly would be acceptable in the United States to use these products. There's enough literature to support your use off-label. Now, getting outside of medications that are just designed for anti-inflammation to reduce pain, what about just blocking pain itself? We all recognize that as arthritis gets more significant and progresses, again, I'm a good example of that with bone-on-bone arthritis in my right knee. Oftentimes, just reducing inflammation is not enough. We actually need to desensitize pain responses in order to feel better. We have both narcotic and non-narcotic drugs that we can consider in dogs and cats to hopefully help in reducing that pain response if drugs like NSAIDs combined with omega-3s or other chondroprotectants are just not offering enough improvement in a patient that hopefully has lost weight and doing all the right things. Then we need to think about actually blocking the pain response. So gabapentin has been a popular drug in veterinary medicine for a variety of reasons over the last 5 to 10 years, from neurologic anti-seizure use to preclinic examination sedation for cats, where it works very well. But certainly it also is a drug that alters the pathways for chronic pain and can be used in osteoarthritis patients. You'll see the dosages there are a bit different for dogs and cats. Dogs probably do need to take gabapentin at least 2, if not 3 times a day at a higher dose, where cats are able to take a smaller dose, usually once or twice a day. Again, this is a drug that will provide analgesia through blocking or altering some of the central neuropathic pathways within the spinal cord. It basically decreases cellular calcium influx and basically tamps down excitatory neurotransmitters. So again, you're not responding with that painful response to a pain stimulus. Gabapentin has excellent oral bioavailability, so both dogs and cats, the drug is going to get into them with good levels when given orally. It does have a rapid peak to a serum level, so within 30 to 90 minutes, most patients will have some benefit from these drugs. One of the problems, though, it does have a shorter half-life, thus the need, especially in dogs, many times to give it multiple times per day. Certainly, it could be used as a standalone drug, but in most cases, we're combining it with an NSAID and some of the other multimodal approaches to arthritis. Biggest limiting side effect is ataxia and sedation. And you'll certainly see that. My daughter's cat's being treated for cancer currently, and we give Milo gabapentin before he comes into the clinic. And it's a wonder drug because we used to have trouble handling him in the clinic. And it's a very nice drug, but he is definitely sedated and ataxic on a 100 milligram dose. So just be aware that owners need to know that this could create some issues. Most of the patients will either respond better if you lower their dose, or with time they may just adjust to the dose, and the sedation effect may not be as predominant. It is the drug is predominantly cleared by the kidneys. So again, in your older arthritis patients, they have evidence of impaired kidneys. That's something to take into effect. You definitely might want to consider starting at lower dosages in those patients. One other big important point, because gabapentin is used quite a bit, for smaller dogs, it does come in a human generic oral solution. But be aware that the oral solution for people does contain xylitol, which we certainly know is a potent toxin when given to dogs. So you definitely do not want to use the commercial solution in dogs. The good news is it can be used in cats, as xylitol is not a toxin for cats, fortunately. Now, if you get it compounded through one of the major compounding pharmacies, of course, in veterinary medicine, they're not going to use xylitol in their solutions. And certainly you can question them, but they're all aware of that and wouldn't put it in there. So gabapentin definitely is a nice drug, I think, combined with NSAIDs and other modalities. If gabapentin is not accepted by the pet, it's usually my first pain relief medicine. But if it's not handled well by an individual pet, you also have a drug called amantadine. Amantadine blocks pain through a different mechanism of action. It basically is an antagonist of the NMDA processes. And again, if you remember, that plays a role in potentiating pain. So if we can antagonize that receptor, we can reduce the level of pain. It's not a great acute pain drug, but it does react or work best in states where you have chronic pain, like osteoarthritis. When it's in your system, it has an ability to continuously block that kind of windup, if you will, that goes along with daily pain from arthritis. Again, it is eliminated by kidneys, so be careful with the dose. This is a drug that has a much more narrow therapeutic window compared to gabapentin. It can certainly create anxiety, can create some restlessness, what goes along with that. A dry mouth is reported by people, and we do see animals, especially dogs, kind of with tacky gums and doing a little swallowing. And it can cause GI effect, diarrhea. I haven't used a lot of it. I have not really used it much in cats, although it can be given at the same dose as dogs, 2 to 5 milligrams per kilogram once a day. Dogs sometimes require it twice a day. And again, it can be certainly a drug that can be used in combination. I usually, again, only use it when gabapentin is not tolerated by a patient. But it's out there for you, and certainly is written in all of the current multimodal approaches to arthritis papers. Getting into narcotic drugs, Tramadol is sort of a dilemma for us, I think, in veterinary medicine now. It's become a controlled, DEA-controlled class 4 drug. We know it works in cats. Cats seem that their metabolite activity for the mu receptor in response to Tramadol stimulating it is higher than dogs. Also has better bioavailability and a longer half-life in cats. So it's a better drug narcotically for cats, but the problem is it tastes horrible. Most of them, no matter what we put it into or make it, really don't like the taste of Tramadol. It can also cause cats to get a bit dysphoric and not eat and get constipated with long-term use. So again, it's a drug that although cats probably do in fact maybe get analgesia effects from it, they just don't like to take it. If you're trying to get cats to take something they don't like, God bless you. You're going to be losing some fingers probably in the process. As far as dogs go, that's where the real dilemma is. I mean, it really seems like from a lot of the literature that's been published, it's conflicting, where early papers suggested that it had decent analgesic effects. Recent papers suggesting maybe a lot of that's more placebo effect, and it really doesn't create that great of an analgesic effect for dogs. Bottom line is, again, if you use it, if it's providing a good clinical response, I would continue with it. Dogs do need to take it more often than cats, sometimes even 3 or 4 times a day to have an appropriate analgesic effect with Tramadol. Be careful if you have older patients that are getting selective serotonin receptor uptake drugs like fluoxetine. It will raise your blood levels for those. And the same with drugs that are the monoamine oxidase inhibitors like salicyline. which I don't think too many people, but some use it for cognitive behavior. Again, it can be a problem if we're using Tramadol with those drugs. The good news is it doesn't affect kidneys. Narcotics are relatively kidney sparing, which is good for our older patients. I use buprenorphine occasionally in patients with diseases that involve their osteoarthritis, but more for breakthrough pain. I don't use it chronically. We can certainly give it in cats transmucosally, buccally. Same with dogs. Has a large safety margin, but again, probably not a great chronic drug for use. Use it for breakthrough pain for a day or two, and then hopefully you can get back on to your other non-narcotic type drugs. There are other narcotics out there like hydrocodone and codeine, class 2 drugs that could be considered. I think the literature is somewhat mixed on how effective these are, especially with chronic use. There can be significant GI issues with higher dosages of these. Big thing we want to make sure of is that people don't reach into their medicine cabinet and give codeine with high levels of acetaminophen combined, especially in cats. So if we are using these, be sure that people aren't using that combination. So let's get away from drugs then for the rest of the talk and talk about other modalities that are non-drug, non-nutraceutical. These are modalities that are going to have really no impact in kidney, GI function, coagulation, or any of those things, and can be used as complementary. Like any other complementary modality in veterinary medicine, you have various reports as to how efficacious any of these things are. You have some people that are ardent believers that one modality works tremendously better, and you have some people that really are skeptics and don't believe it works well at all. But they're all out there. And again, the key thing is they really don't do harm to patients. And if they can allow us to reduce NSAID dosages and make patients more comfortable, then I'm all for it. So CC Animal Health is who's helping us today with this webinar. They have a product that uses the pulsed electromagnetic field therapy, EM therapy, very well looked at, over 100 years of medical interest in the PEMF therapy for people. Again, electromagnetic fields have a way of disrupting or changing cellular activity. So it's on a cellular level. It can influence how tissues metabolize, how hopefully they reduce pain responses, how they maybe help tissues repair and grow. Again, they affect gene expression. There's a lot of things that's been shown that these electromagnetic fields can do. And there's numerous reports, again, in people for decades about use with arthritis, and some more recent ones in the veterinary medical field. A couple of things I like about pulsed electromagnetic field. And I'll tell you, since I got involved with my own arthritis and with the CC, I've been using pulsed electromagnetic field on several of my joints. A couple of things I like about it. I think it does help me. It might be placebo, but I feel better since I've been using that in addition to other modalities. What I like about it for pets, though, it's home therapy. You don't have to go to the doctor's office to use it. They can be given several times a day, treatments at home. It's drug-free, so it's non-invasive. There's really no adverse effects at all that have ever been reported. And again, if it's effective and it reduces some symptoms, it may reduce the dependence on some of the other osteoarthritis treatments. We can target it to individual sites. If your knee bothers you more than something else, we can treat your knee specifically. Assisi is developed and involved in some randomized placebo-controlled studies, which do show, at least one of them, that there is some pain relief documented that allowed narcotic use to be reduced in patients with osteoarthritis. And they have some ongoing interest in current studies, so hopefully we'll see more beneficial things about this. The CC, and they'll talk at the end to say there's a variety of ways you can use these things. They're pretty cool, called loops. They fit around the extremities of animals, so you can target individual joints. They can lay on top of a patient if they'll sit there, as you see the cat in this picture here doing over the hip joint. You can go ahead and put them on these little elastic t-shirts that can target certain areas over the trunk and keep that loop and that electromagnetic therapy in that region. And even they can be placed in bedding where you can treat the entire body of a cat or small dog when they sleep. So kind of some pretty neat ways that CC has developed them for use in animals. What I didn't show you on the initial one is here you see the loop. And again, it puts out this electromagnetic pulse in about 10 inches from either side of the loop. So if you slip an extremity into that, where you place this over an area of interest, you're going to get about a 10-inch on either side field of therapy for those specific tissues. So again, very interesting thing, I think can be used as an adjunctive treatment. We also have acupuncture, which has been used for, I don't know, centuries, I would think, going back as a complementary thing developed, I'm sure, in the Far East. Acupuncture, I don't know a whole lot about the mechanism of action other than it's a specific stimulation of certain neurohormonal pathways that reduce pain. Again, nice things about it for veterinary medicine, outpatient therapy, but again, it's a quick trip to your acupuncturist. It is drug-free, but it is considered invasive because you are sticking needles into it. No adverse effects, unless it was probably me, because I'd probably stick it into the jugular vein or carotid artery or something, knowing my luck. But people that are experienced with acupuncture, there's really no adverse effects that we're concerned with in these patients. And again, it may reduce the dependence on other therapies. For years now, in patients that have significant arthritis in my practice as an internist, I have sent them to complementary veterinarians for acupuncture therapy with many, many positive reports. And again, how much of it's a placebo effect versus true pain reduction, I never can document that on my own, but I am a believer that there's a place for acupuncture in patients that have significant arthritic pain. Cold laser therapy become a very popular treatment in veterinary medicine. It's one of those ones that has many arduous supporters and many doubters as to how much it does. I've tried myself cold laser therapy, did not provide benefit for me. I have colleagues that tell me they do so much better when they treat with cold lasers. Again, basically changing the way tissues react on a cellular level to hopefully reduce pain, inflammation, and promote healing. Again, another outpatient therapy, drug-free, non-invasive. You do have to wear the goofy little glasses, both you and the patients, so that we don't damage our retinas with laser. But again, it's another therapy. It's available. It's out there. It's costly because you're doing it in repeat sessions. But it's something that for the right owner that wants to pursue that sort of therapy, I think it's certainly potentially beneficial. I don't know what to tell you about stem cell therapy and platelet-rich plasma therapy, PRP therapy in veterinary medicine. When putting the slideshow together last year, I looked for a slide that showed me something, and this is what I found on Google search. Now I'm worried it looks more like the COVID virus, so I'll have to point out that is not COVID-19. That is platelet-rich plasma therapy photo. But bottom line is these are therapies that should hopefully, again, help you regrow tissues, regenerate, repair damage, leading to less painful and less inflamed joints. I think the jury is still very much out on efficacy of these types of therapies. I am happy to see multiple universities, though, now have regenerative medicine departments and are taking on evidence-based controlled studies. So I think in the next decade, we'll have a much better idea. We still don't know in people how beneficial these things really are, unless you're one of those arduous people that absolutely believes it works. We just don't have the evidence-based studies yet that we can convince ourselves that it's a mainstream part of medicine. Then I get into cannabinoids. Oh my goodness, I don't even know what to tell you about that. Yes, I tried CBD for my joints. I did not get a lot of help personally. There's a lot of potential legality issues. Studies, again, are ongoing. Colorado State, Cornell, North Carolina State, all have ongoing studies. So I think we'll have some ability over the next few years to really get a better handle on what the effects of CBD. What do I tell people? It probably doesn't hurt your pet. If you want to go ahead and explore using it and use it of your own volition, certainly feel free. Again, I don't think it's harmful. It doesn't hurt kidney function or anything like that. And if the owner wants to give it and feels it helps, then I'm okay with that. But I certainly don't prescribe it yet myself unless I have more evidence-based studies to tell me that. Finishing up today, guys, use things that make life easier. There's lots of medical assist devices now that are out there for patients with arthritis, from putting on the anti-slip boots to harnesses to help patients get up and down stairs. There's ramps. There's certain braces that can be put over individual joints that may need a little bit more stability. And all of these things can certainly help our arthritic patient at home. So I certainly would not overlook that as a part of your multimodal approach to significant arthritis. And lastly, modify the environment. Make it easy for our pets that have arthritis, just like make it easier for old codgers like me to get around the house. I now live in a house with no stairs. Man, that's a great thing. But if you have a cat who has to get up this device every day to get to a food and water bowl, maybe that's not such a good idea. You know, make easier access to food and water bowls, litter boxes for cats, easier access to getting up and down on furniture for dogs and cats or windowsills. Heated beds. I didn't even realize until 2018 that they actually have consumer ratings on what are the best heated cat beds. But again, heat sometimes can help relieve some of that stiffness and pain related to arthritis. So lots of things we can do to modify their environment in arthritic pets as well. So in summary today, multimodal, complementary treatments. Again, it's not all about just drugs. It's not all about just NSAIDs. We want to use a multimodal approach that includes, very important, weight loss, get back into condition, maintain moderate activity, don't become a couch potato, get these patients up and moving so that they don't develop worsening of joint effusions. We want to choose our drug therapies carefully. I'm not saying we shouldn't use NSAIDs. We definitely should. But again, we want to look at the other nutraceuticals, other therapies that we have that can hopefully complement the use of NSAIDs and possibly reduce their dosages or potentially use them on an as-needed basis. Again, we want to look at many of these ancillary non-drug therapies like electromagnetic therapy, like acupuncture, that we know hopefully provide some relief of pain. And lastly, because I'm a pretty big cat advocate, I live with a bunch of them right now, and they would be mad at me. And if I was remiss to mention, please be careful with polypharmacy in cats. Choose therapies that cats handle well, and life will be much better for you in a feline household. So my last thing for you is a video. If you do all these things, here's what happens to dogs. Absolutely no arthritis in this guy. This is Stella, and she definitely has an affinity for jumping into leaves. So if she ever develops arthritis, we're going to have to take a very good multimodal approach. You'll probably see her in the clinic for respiratory disease long before you'll ever see her coming in for arthritis. So thanks to Sissy Animal Health for sponsoring us today. Nicole, Julie, Carolyn, thank you so much. I'll turn it back over to you guys. And if there are questions, you can